So I really think that not all cases are acute the way it was originally described. And when you really get into the histories of these children, you realize that they've had symptoms for a long time, almost like a snowball going down a hill. Like it just gets bigger and bigger and bigger.
Bigger and bigger, yeah.
Until you get to the point where it becomes an avalanche, or, like a kettle of boiling water, like a glass kettle with boiling water. You see the bubbles rising until it comes to a point where it boils and spills over. So that's what it is. So you have brain inflammation or neuroinflammation, and it's acute in onset. That's the classical description of PANS.
Hi, I'm Dr. Monica Harrigi, and welcome to Truly Healthy MD. I have one question for you. What's really behind the way you feel? As a functional medicine doctor, I'm passionate about helping you uncover the hidden causes of your health concerns and finally connecting the dots. From balancing hormones to overcoming Lyme disease, boosting brain health, or just finding new ways to feel your best every day. This podcast is packed with insights and strategies to help you take control of your health and live fully. Ready to explore what's possible and be truly healthy?
Hi, welcome to the show. Today, one of my colleagues, and I have the pleasure to call her my dear friend also, Dr. Saima Khan, is joining us. She is a physician with over 27 years of experience and a very deep personal story of resilience and transformation that I cannot wait for her to tell us a little bit more about. I do know that she was diagnosed with narcolepsy in 2016 and stepped away from her conventional medicine practice that she had worked so hard to work up to, but she found herself navigating the healthcare system as a patient. But Dr. Khan is a full-fledged physician. She holds Doctor of Medicine. She's board certified in pediatrics and certified in functional medicine from the Institute for Functional Medicine. She also has advanced training in chronic illnesses like Lyme and co-infections and mold. She's the founder of Rebalance Family Health. Thank you so much for being here, Dr. Saima, and thank you for being my friend. I know you and I go back a few years together, so I'm so excited about having this conversation and talking today about PANS and PANDAS, something that's really complex that touches a lot of people's lives, maybe a lot of people who don't know about it. So welcome to the show, Dr. Khan.
Thank you so much for having me here. It's really an honor.
Yeah, so just a little bit more about yourself. Like I said, I know a lot of us find integrative medicine when we're conventional doctors, and we know that there have to be more answers out there than what we're taught, right? So tell us a little bit more about your personal struggles and how you found integrative medicine.
So, looking back, I had fatigue for many years, as I can think of being fatigued as far back as I was in medical school. And, you don't get sick all of a sudden. Things don't happen. Those imbalances, they creep up in your body and they continue over the years if they're not addressed. And unfortunately, the conventional system does not really address the imbalances the way they should be. So I finally crumbled in my 40s or crashed in 2016 when I was diagnosed with narcolepsy, but I had symptoms way before that. And I'd been to doctors and, my labs were normal. My exam was normal or supposedly normal. And, but things were not right. And what I learned from this experience is that it's quite humbling to be a patient. And so eventually when I was diagnosed with narcolepsy, I went through the usual medications, the stimulants, medications that keep you awake, but they would not work very well. And they gave me side effects. And when I got to the point where I was having a hard time driving, despite being on those medications, I decided there was something to look into myself and take my health into my own hands and figure out what was wrong with me. And that's when my journey into functional and integrative medicine began. And, all those imbalances that you mentioned, I basically uncovered those and many more.
Yeah,
and in the process, I realized that, narcolepsy is also an inflammatory brain disorder, not quite PANS. PANS by definition is pediatric and acute, but there are other disorders with overlap of brain inflammation. And narcolepsy is one of those disorders where there's autoimmunity, an autoimmune attack on parts of the brain and inflammation in the brain. So there's so many overlaps with PANS and PANDAS.
That is super interesting. And, all these neuroinflammatory conditions are pretty new to all of us as a medical community. I think we're just learning about them as each year goes by. We learn more and more. Like, I had never even heard of PANS and PANDAS when I was in medical school and early in my training. It wasn't until I was a full-fledged MD that I started hearing about it. I treat mostly adults, so I don't treat the pediatric population. But when I started hearing about it, and the counterpart of we do have a lot of, like you said, neuroinflammatory conditions in adults too, that either are similar continuation of PANS or they just share some similarities, but they're not really a continuation of PANS. And it's amazing how much neuroinflammation is out there and is causing a lot of things that we just, ascribe to. Person's anxious, person has, whatever, bipolar disorder, but it's truly an inflammatory condition of the brain. And medical science is growing in leaps and bounds, learning more and more about this each year. So it's a fascinating thing to study about. And I'm sure it was scary to go through as a patient. So glad that you healed. I'm sure it was quite a journey for you to heal.
It was absolutely quite a journey, lots of ups and downs. Lots of unknowns, but once I started feeling better by doing things that I was really not trained in and, that I hadn't learned about, I realized that there was a paradigm outside of what I'd been trained in, outside of that conventional Western medicine toolbox. And as one of my colleagues put it recently, you just have a bigger vocabulary. As a functional and integrative doctor, like, once you start looking into all these other treatments and modalities and root causes of illnesses.
If you like this discussion, please hit the subscribe button and consider leaving us a review. It really helps people find us, and we truly appreciate your support. Absolutely, yeah. And this is something that's it's complex for us to study as a medical community, as scientific community, all these neuroinflammatory things. I'm sure it's very taxing as a physician to be treating these conditions. So for our listeners, a lot of our listeners may not even know what PANS and PANDAS is. So can you break it down for our listeners, those of people who are listening and are like, wait, what is this? Back to the basics. What exactly is PANS and PANDAS?
Absolutely. So PANS, I would say, is the umbrella diagnosis, which also covers PANDAS. PANS stands for Pediatric Acute Neuropsychiatric Syndromes. And one of the causes of the pediatric acute neuropsychiatric syndromes is strep. So PANDAS is Pediatric Acute Neuropsychiatric Syndromes due to strep. So basically, by definition, it happens in the pediatric age group. But, you can have it happening in older people or patients, adults as well. But it was first identified in children. It's acute, so it's sudden in onset. And this was initially recognized back in the 1990s. So I really think that not all cases are acute the way it was originally described. And when you really get into the histories of these children, you realize that they've had symptoms for a long time, almost like a snowball going down a hill. Like, it just gets bigger and bigger and bigger.
Bigger and bigger, yeah.
Until you get to the point where it becomes an avalanche, or, like a kettle of boiling water, like a glass kettle with boiling water. You see the bubbles rising until it comes to a point where it boils and spills over. So that's what it is. So you have brain inflammation or neuroinflammation, and it's acute in onset. That's the classical description of PANS. And the way it manifests is that you have brain symptoms. You will have symptoms of anxiety, OCD, anorexia, or loss of appetite, emotional lability, brain fog or ADHD, handwriting deterioration. You can also have urinary frequency and sleep disturbances. And you basically need two of these criteria and an acute onset to diagnose PANS. But in my experience, a lot of these patients may have had an acute onset that's been missed, and they're presenting to you much later, and you basically need two of the symptoms to clinically diagnose PANS. And you also, one of the other things is tics.
Fatigue, brain fog, mood swings, weight gain. If you're a woman in your 40s to 70s, you've probably been told that it's just aging. But what if it's not? At trulyhealthymd.com, we look deeper. Hormones, nervous system health, hidden toxicities. You're not broken. You just need a doctor who really listens. Visit trulyhealthymd.com and book a consultation today. It's time to feel like your real self again. Tics, yeah, motor tics. And so since this is a somewhat new thing, I mean, you think the 90s, that was so long ago, but honestly, in the whole evolution of medicine, it's something pretty new. So not all physicians are aware of this. I know it's something that is even controversial in some areas. I know of a lot of academic institutions that study this and they completely embrace it. But in your experience, how many of the pediatricians that you come by day to day are actually aware of this, and how many just still are in the dark about this?
Actually, the majority of them, unfortunately, are not aware of this. And actually, they will dispute the diagnosis or actively tell the parents sometimes that there is no such thing as PANS and PANDAS. So that's the unfortunate part of it. It's medical ignorance. I think that's what I would call it. We didn't learn about this during our medical training. I did not learn about it, at least. So initially it was described by Dr. Suedo in the 1990s. I think it was 1997. And I completed my residency in the early 200s, and I did not learn about it during my pediatric residency, even after, I started working. This is not something I learned about. It was much later, once I got into the functional and integrative space and, reading about my own illness and researching, and, I came across PANS and PANDAS. And as a pediatrician, once I started seeing children, that's the kind of patients that started coming to my practice.
So interesting. I'm sure it's such a wonderful thing for all those children to have you as a resource, since there's so few doctors that are actually aware of this and trained. So what a fortune all of your patients have to find you. I'm sure you have like a set of resources when you talk to parents and you're like, this is a real thing. I'm not just making this up, right? Do you send them to like academic institutions? Where do you help people learn about PANS and PANDAS?
So as far as learning about PANS and PANDAS, first of all, it's a clinical diagnosis. A lot of times in today's day and age, with the kind of resources that patients have at their own hands, they have access to social media. Sometimes they will hear about something on social media, or they will have somebody else tell them about this. Of course, there are parents who have no idea that this is what their child has, and they're simply looking for something outside of that conventional Western medicine approach of using pharmaceuticals, or they're trying to find the root cause. And when they come to me and I'm able to identify it, then, when I tell them about the diagnosis, I give them resources. So there are some websites, such as the Aspire website, the PANS and PANDAS website, and there's some great books written by Dr. Nancy O'Hara, by Dr. Scott Antoine, and Dr. Jill Christa, who is a naturopathic doctor. So, and there are some other books also, but these are the three main ones that I recommend to my patients.
Excellent. I'm glad there's a lot of good sources of information, because it's so much harder when there aren't sources of information. We're just trying to figure this out as a scientific community. So it's good for patients to be informed, to advocate for themselves. But I'm sure it's a very hard disease to understand. Even as a physician, it took me a long time to understand it. So what else can you tell our public? What are the primary triggers and underlying causes for PANS and PANDAS, and how do these relate to infections, immune dysregulations? How do you explain that to your patients and to our public?
Sure. So PANS and PANDAS, they happen due to an abnormal immune response to an infection or a toxin or stress. Now, there are a lot of infections out there. The PANDAS obviously is recognized, strep, But besides strep, you can have any of the number of viruses that are out there. Now, COVID has brought this to light. People with long COVID or acute sort of, brain health symptoms after COVID, they also fall under this acute neuroinflammatory syndrome category, which includes both children and adults. But besides COVID, any of the other viruses, influenza, herpes, Epstein-Barr virus, any of these viruses can trigger PANS. You can also have mycoplasma or strep, as you know, but the ones that are commonly missed are Lyme and co-infections, especially Bartonellosis. And that cause typically will manifest as rage or aggression. So those are the infectious causes. And then you can also have toxin-induced PANS. And in my population in Florida, mold is something that I find in 100% of my PANS cases. And I think it is one of the big triggers of immune dysregulation, and even in other parts of the country, because people can be in moldy environments, moldy homes, moldy schools. But besides mold, any of the other environmental toxins, such as heavy metals, glyphosates, anesthesia can be a toxin as well. So all of these things can trigger a PANS episode. And besides that, stress. So what stress does to the immune system, it lowers the immune system. So if somebody's got an infection in their body, which the immune system is keeping under control, then with stress, the immunity can go down, and that infection can manifest, resulting in symptoms of PANS and PANDAS due to an abnormal immune response to the infection. So an easy way that I explain to my patients is that the body mounts an immune response against the infection and generates antibodies. Now, those antibodies attack the infection to try and get rid of it, but they also mistakenly recognize brain tissue, especially in the basal ganglia, which is your caudate, putamen, and totally blanking out.
Amygdala and all that.
Amygdala, yes. Caudate, putamen, and amygdala. Those parts of the brain get attacked, and that results in the symptoms of PANS and PANDAS. So there's something called the concept of molecular mimicry. The antibodies recognize the brain tissue as if it was an infection and attack it. So simplistically, that's a way of understanding it. And you have to control the infection. You also have to address that immune dysregulation. And then, these children, a lot of these children have been sick for a long time. They may have been missed. So they've got these abnormal sort of neural patterns, and those have to be re-regulated. And so that's also a part of the treatment.
Wow, that's so complicated. It sounds like it must be a very difficult, distressing sort of condition to have. I mean, one can imagine the brain is being attacked by the immune system. It's causing inflammation. So what are the most common clinical presentations that you see in your practice?
So in my practice, I see the big ones that I've seen are OCD and anxiety and rage. But besides that, sleep disturbances, some of these things, anxiety, OCD, and rage are quite obvious, and disturbing, and they are also disruptive for the family. But then you can see other things like handwriting deterioration, ADHD or brain fog. The child is just not able to do as well in school as they were before. And then looking for things like sleep disturbances. They're not sleeping so well anymore, and having urinary frequency. So overall, I've seen all the different symptoms, but anxiety, OCD, anorexia, those are kind of the most obvious ones, and they can be really incapacitating for the child as well as the family.
Wow, that's so tough, especially, seeing children that are affected by anxiety. But by the same token, I'm sure that they find it very comforting that, as opposed to going to, a different type of approach where parents might be told, hey, your child's anxious, give them a medication. They might be on the medication for months, years, their whole life. We don't know. they're going to you and you're telling them, okay, they are anxious, but I know why, and that's something I can treat. So I'm sure it's a lot more gratifying for you as a physician to be able to practice this way and offer things to patients as complex as they come to you. Or what has your experience been as, because you're a human too. We want to know what your human experience is as a physician treating these PANS kids.
It is very gratifying. Some of these kids have been missed for years. I've had children who've been missed for 7 to 8 years. They've been on psychiatric medications, and they've been on different medications than, one after the other, because the first medication stopped working and so forth. And the parents come to the point where they're looking for answers, and that's how they start looking outside of the traditional physicians that they've been going to. And it's really gratifying to, help these children have them get their lives back. I had one child who was actually told by their developmental pediatrician that the child needed to be institutionalized.
Oh, wow.
And after treatment for PANS and addressing the mold and the Lyme and, re-regulating the nervous system. I mean, it is a lot of work. It doesn't happen overnight. It takes time. Sometimes it can take a year or a couple of years to get these children to better health. But it's really gratifying to see how they improve and how they get their lives back. And, they're able to go to college and be independent in the workforce also.
Yeah, and I'm sure it takes a ton of your emotional energy to treat these people too. It must be exhausting, but at the end of the day, so gratifying to be able to give kids their potential back, their potential of thriving. It must be something really hard to diagnose too. So what are the key challenges that you see in diagnosing PANS, PANDAS, other inflammatory disorders? And I think as physicians, a lot of times we're taught that psychiatric things are symptoms equate diagnosis equate treatment, right? You come to a mental health place because you have anxiety, you're diagnosed with anxiety, and you're treated with an anxiety medicine, right? Which is not how we see things in root cause and functional medicine. We are like, okay, it's presenting as anxiety, but the root cause is something else. But it's a tough process, right? To go through that diagnosis process. So what are the things that you use and other clinicians use to differentiate PANS and PANDAS from other psychiatric or behavioral conditions?
Well, that's the part where there's so much overlap. So when you have someone in front of you who's got these psychiatric symptoms, you have to really tease through the history, figure out when things started, what kind of symptoms they've had all their lives. Sometimes some of these children will have symptoms since birth. You also have to get back into the history of the pregnancy of the mother. Like, how was the child moving during the pregnancy, for instance? For instance, if it's congenital Lyme, these children will have low tone at birth. They may not have been moving very well during the pregnancy. They may have constipation. They may have been a colicky baby. So looking for these subtle things, and then developmental milestones. Frequent infections sometimes can be a clue to their immune system not working really well. And then tantrums. Sometimes these children just have a history of tantrums, like they were just hard to console. And, gradually things started getting worse, and somebody pointed out that they had anxiety, or, in the conventional world, they had sensory integration disorder, which can be a clue towards mast cell activation. And poor development of their nervous system. So looking for all these kind of clues, and then looking for, those symptoms and identifying 2 of them. I use 2 symptoms. I have a higher index of suspicion for a diagnosis of PANS or brain inflammation, or even a subacute sort of a onset, if they have 2 of those symptoms present. So it's a clinical diagnosis, but you have to support it with lab findings. So as far as the diagnosis of inflammation in the brain, now that's a hard one because the labs are few, and the conventional labs are not great at picking up the inflammatory markers as far as the brain inflammation or the antibodies against the brain. And there's specialty testing, such as the neural zoomer or the Cunningham panel, but I don't usually use that in my practice. I'm really more interested in finding out the inflammatory markers on the blood, the ANA, which is an autoimmune marker, and about 60 to 70% of the children will have an elevated ANA, and sometimes they've been dismissed. A mildly elevated ANA, 1 to 64, but their pediatrician has dismissed it, or they've just not paid much attention to it. So looking for subtle things and then looking for infections. So I do run viral panels. I look for strep. I look for mycoplasma. My practice is virtual, so I have the parents, I take the child to their pediatrician and get a strep swab, making sure that they don't have strep around the anus, they don't have anything going on in their mouth as far as a dental infection, their oral hygiene is good. If sometimes these children may have braces, and just that bacterial growth around the braces and poor oral hygiene can trigger that neuroinflammation.
Wow.
So looking for all those kind of things. Also, looking for mold. Being in Florida, I always look for mold, and also get a history. Usually I'm getting a history that there's been a leak in the house somewhere, or they moved and they found some stains on the walls, and so forth. So there's usually a history in my patient population of mold exposure. And I also have a low threshold for testing them for Lyme and co-infections. And even though I am in Florida, a lot of the population in Florida has moved from the Northeast or other states. And the recognition of Lyme and co-infections is not there as much in Florida, but it is present. And I've had patients who've been bitten by ticks in the state forests in Florida. So Lyme is there. And then some of these children may have a cat at home, and that can be the source of Bartonellosis, but you can also get Bartonellosis from spiders and lice. So there's so many other ways that these infections can be, transmitted. So I do look for, based on symptoms, with Bartonella, for instance, the common symptoms are brain fog. You can get rage, you can get heel pain or foot pain. Sometimes you can have one-sided symptoms. And also you get these really interesting skin findings called striae, which have sometimes been dismissed by their regular doctor as striae due to, growth or just stretch marks. But Bartonella can cause those very impressive striae. I had one child, for instance, who had striae on her breasts and buttocks, and those got better with treatment for Bartonella. So those are the kind of things you look for. Then with Lyme, you're looking for fatigue and joint pains and headaches. And with Babesia, you can have dizziness and POTS kind of symptoms and headaches again. So those are the kind of things I look for by history. And then with the viruses, you can have just flu or COVID kind of symptoms, or there may be a history of onset after having a viral infection. Usual viral symptoms, fatigue, fever, upper respiratory symptoms, those kind of things. And strep, you can get a headache, sore throat, belly pain, and fever. Those are your classical strep symptoms. So you may get a history of having symptoms of a viral infection or a strep infection in the recent past. Or sometimes you have to really dig through the history and find out if they had an event or an episode several months ago or a few years ago that resulted in their psychiatric symptoms getting triggered, or if the child developed the psychiatric symptoms after moving into a house or after one of the hurricanes when they had a leak in the house. So looking for all those kind of clues is super helpful.
Yeah, absolutely. No, there's no lab that's ever going to compare to doing a great clinical history, getting to know our patients, a good physical exam. Labs are absolutely useful, and we love having them. But yeah, that physical exam, that clinical diagnosis, there's nothing that'll replace that ever. I haven't heard you say anything about any radiologic studies. I know they're not the mainstay of diagnosis in PANS and PANDAS, and there are some PANS and PANDAS doctors that say they never get them, some that say occasionally. Is that something, any MRIs, neuroquants, SPECT scan, is that anything that you use in your practice or that you would recommend to patients?
So I don't get them routinely, but I have got them occasionally in a child where they come to me with severe headaches, for instance. Those red flag kind of symptoms, perhaps. So severe headaches, they're just not getting better with treatment. That would be another thing that would make me think of getting an MRI. But generally, I'm not using an MRI in these patients. Or they may have already had an MRI by their conventional, psychiatrist or neurologist. So they may have already had it, but generally it's not one of those tests that I'm looking to get unless there are certain clues that are triggering me to get it.
Yeah, absolutely. And, just so hard for people to, to know what to expect when they're dealing with these diagnoses that they've never heard of, and such a complex thing. So your clinical knowledge is so helpful for patients and their parents, and guiding them through this whole process. I'm sure that you have to stay abreast with all the, latest clinical research. Do you spend like half your time studying, half your time seeing patients, or how do you stay up to date with all these things? I'm sure there's new things coming out every day, right?
I do spend a lot of time reading and trying to keep up, and obviously attending conferences, and I don't see patients every day of the week, because with this kind of work, you really have to spend time keeping up with the literature, keeping up with what's out there, the kind of treatments that are out there. And of course, attending conferences, meeting colleagues, exchanging thoughts, all those things are really important in this kind of work.
Yeah, absolutely. And so what is the latest in, the research as far as the connection between inflammation and autoimmunity and brain function? What are those more recent things that you've learned that you can tell us about?
So I think COVID has really brought a lot of things to light. With COVID, people developed, there is such a large number of people that have developed long COVID. And one of the symptoms of that is brain fog. And then other people have also developed other neuropsychiatric symptoms. So that tells us that, inflammatory conditions can give you brain symptoms. And there is an autoimmune component also. People will develop autoimmunity after COVID. So I think extrapolating from that, you can also, sort of understand that this is an inflammatory brain disorder. As far as specific research goes now, there are people who are looking into inflammatory markers, but from a clinical perspective, from the perspective of being on the ground, being in the trenches, teaching or treating these patients, a lot of the work that is done in the functional and integrative space, that is really hands-on, experience-based. And you obviously look at the data also that's out there. But a lot of times you have to sort of extrapolate from clinical experience and, treatment of other conditions also.
Yeah. Not everything is a randomized controlled trial. We wish there were controlled trials on everything. It would make it easier for us to make treatment decisions if everything was just a protocol, right? But there isn't. We have to learn from our own clinical experience and relying on our colleagues. So it's so great that you're in the trenches and seeing this day to day and contributing to this science. Where do you see the future of these conditions and these treatments going?
I think you really have to increase the awareness that it's still one of those conditions which is really poorly recognized. Even physicians don't recognize it. There are physician parents whose children have PANS and PANDAS, and sometimes they don't even recognize that their children have PANS and PANDAS, or they're directed towards a physician who's treating PANS and PANDAS, or a group that talks about PANS and PANDAS once they bring up their child's symptoms or raise the question about it, out of desperation, really. So the first step is really, in my mind, increasing awareness about these conditions. Like, these are not specifically neurotransmitter issues. These are inflammation issues, just like the knees can hurt due to an infection or an inflammatory condition, or you have asthma, and asthma is an inflammatory condition of the lungs. And you can get an asthma attack, and you can get a low-grade, chronic cough due to this low-grade inflammation going on in the lungs. The same way, you can have an inflammatory brain condition where you have these neuropsychiatric symptoms, which are a manifestation of the brain inflammation. So just raising the awareness, like, there are psychiatrists who don't know about this, there are pediatricians who don't know about this, and they're the ones who are seeing these kids, much more frequently.
Yeah, they're in the front lines of diagnosing our children, our next generation. Yeah, it's scary to know that the information's out there. It's just not getting to the medical community and to the parents, because it's there. There really is. The research is there. It's we're in the age of technology, right? Any of us can do a Google search and find a lot of stuff. So that's really sad that the information's not getting out there. I know there's some organization. I think you mentioned some of them. Aspire, is that what it's called? There's a lot of advocacy and teaching, and that's what needs to happen in order for more of these kids to be recognized, and they can be paired up with a good clinician like you to get them diagnosed and treated.
Thank you. Absolutely.
Do you have any? Do you feel like you have an easy time or a hard time talking to physicians who treat PANS and PANDAS, but are, let's say, resistant to embrace some of the things that are in the toolkit that's in the integrative medicine toolkit, such as considering Bartonella and chronic Lyme? Because, again, I'm not a pediatrician. I don't technically treat PANS and PANDAS because, like you said, P stands for pediatric, and I treat adults. So I treat ANS and ANDAS, right? I treat people who have maybe been a PANS PANDAS patient, are now in the adult category. I have several 20-some-year-olds that are now my patients that were diagnosed as kids, or I'm diagnosing now. They had them as PANS or PANDAS. But even though it is a condition that is recognized by many academic institutions, they're still not as accepting as far as all the different root causes that you and I tend to look for in patients. Is that something that at least it looks like things are going in the right direction? They're considering more diagnoses, or is that something that looks stagnant to you?
I think it looks pretty stagnant to me. I think it's really in its infancy in the conventional world. Like, perhaps there is a recognition of the viruses and strep and mycoplasma, but in my population, I have 100% mold population. I would say 90% of my PANS and PANDAS children have Lyme and co-infections, especially Bartonellosis. And these are just not well recognized in the conventional world. The Bartonella striae, there's so many children who, whose parents will tell me that they have these Bartonella striae, and they've been missed, and they've been dismissed as being just, related to growth or stretch marks. This one child who was actually homicidal due to Bartonella, her parents took her to many different practitioners, and nobody picked up on the Bartonella. And she had these obvious striae. So the recognition is just not there. These are not things that you will find in textbooks. These are not things that you will find in the conventional literature. And so they just don't recognize them. Sometimes they will actually, a lot of pediatricians or practitioners will dismiss these findings as being related to an underlying infection. So unfortunately, it's still very much in its infancy.
Yeah, that's sad. And as sad as the COVID epidemic was, at least that's one good thing I think it did bring to the forefront of the medical community, and them, like, I mean, we're part of the medical community too, but the masses and masses of healthcare providers out there that didn't understand how an infection could lead to a chronic inflammatory condition. Now that we know that long COVID is real, I think a lot of these things are starting to be more accepted by our conventional counterparts, but there's just such a huge gap there that, at least in the patients that I treat, I also find that, and I'm always wanting to try to open up the communication for the sake of our patients and say, okay, there's all this data. Let's try to be more scientific as a community and not just say this is the way I was trained in residency and so I have to do it that way. So I think you and I are probably seeing a lot of the same struggles, even though we treat completely different patient populations, right? You see all the kids, I see all the grownups, but a lot of the same struggles as far as helping science move and grow as we continue to evolve. But the world is lucky to have doctors like you, Dr. Khan. Thank you so much for being a pediatrician who is willing to take on these patients. I'm sure it's been a long road for you as a physician to learn all this stuff, and as a human to continue to, deal with these patients day in and day out. And I'm so happy that you're my friend, you're my colleague, you're here educating people. We'll have, in our show notes, some of these things as far as Aspire, your clinic information in case anybody wants to contact you. If they're in the Florida area, you said you have a telemedicine practice, so anybody in the whole state of Florida can contact you, right?
My practice is 100% virtual, so I see patients from all over the state.
Okay, that's great, because it's so hard to, it's so hard to get access to care to people as specialized as you. So that's wonderful. So this was a ton of information, and I think people are gonna leave this podcast a little bit overwhelmed. So if you could just break it down for 3 takeaways. What if PANS and PANDAS is new to some parents listening out there, to some people who may have a niece or a nephew with this, what are the 3 main takeaways that you're okay, public who's listening to this, what do they need to learn about PANS and PANDAS now to continue to educate other people about this?
So I think some of the biggest takeaways that or the message that I will leave for the audience is that if your child or even a teenager or an adult family member or somebody that has neuropsychiatric symptoms such as anxiety, OCD, anorexia, ADHD, emotional dysregulation or lability, aggression, if they have urinary frequency, or sleep disturbances, if they have 2 of those symptoms, then it is likely that they have a brain inflammatory condition like PANS and PANDAS. And the answer is not just psych meds. You can really help these individuals, you can help these children and adolescents and adults by looking for the underlying root causes and treating the infections or the toxins, and really empower them to lead really productive lives and do much more than what they're able to with just being on the medications. And have to keep looking for answers. That's important. A lot of these families have lost hope. They're not getting better on the medications, so you have to keep looking for answers.
Excellent. Such a great message of hope and healing. It's hard to see patients struggle with chronic conditions. It must be so much harder to see young children struggle with these. So what a light and inspiration you are to the world. Thank you so much for being who you are and doing what you do and coming on our podcast. And I enjoyed this conversation with you, and we'll continue to have more conversations in the future. Thank you, Dr. Khan.
I appreciate you having me. It's been such an honor.
Thank you. Bye.
Thanks for listening to Truly Healthy MD. I'm Dr. Monica Howard-Yee, and I'm so glad you joined me today. Remember, your health is in your hands, and every choice, no matter how small, can move you closer to feeling your best. If you found today's episode helpful, please subscribe, share, and leave a review. It means so much to me. Until next time, take care of yourself and stay truly healthy.